Hey, I'm Dr. Carter, and today I want to talk about something that affects millions of adults over 50 and gets misdiagnosed, dismissed, or completely missed for years. Not because it's rare, not because it's complicated, but because every single sign it produces looks exactly like something we've been told to expect from getting older. Tired? That's age. Weight gain? That's age. Foggy thinking? That's age. Feeling cold all the time? That's age. But what if it isn't? What if a small butterfly-shaped gland in your neck, one that most people never think about, is quietly slowing down every system in your body? And what if the standard test your doctor runs is missing it? That's what this channel is for. The answers behind the symptoms, the science your doctor doesn't always have time to explain. Subscribe now and turn on the bell, because what you're about to hear might change how you understand the last few years of your health. There is a gland in your neck the size of a butterfly. You cannot feel it. You cannot see it. And unless something goes wrong, you probably never think about it. But that gland, your thyroid, produces hormones that control the speed of nearly every biological process in your body. Your metabolism, your heart rate, your body temperature, your brain function, your muscle strength, your mood, your digestion, your hair growth, your skin health, everything. When the thyroid slows down, a condition called hypothyroidism, every one of those systems slows down with it, gradually, quietly, in ways that are so easy to mistake for normal aging that most people spend years, sometimes decades, attributing the signs to something else entirely. Here is what makes this so clinically significant. Research indicates that up to 20% of women may fall into the subclinical hypothyroid range, meaning their thyroid is underperforming, producing real symptoms, but their blood test comes back normal by conventional standards. Normal by a standard that most leading endocrinologists now consider far too lenient. Today I am going to show you the 8 signs that your thyroid may be underperforming after 50, signs that are real, measurable, and consistently blamed on aging by both patients and doctors. And sign number 5 is the one that surprises people most because it appears in a place that nobody connects to the thyroid. Stay until the end, because in the final section I will show you exactly what to ask your doctor, which tests to request, and the 3 evidence-based strategies that support thyroid function after 50 when conventional medicine says your numbers are fine. Let's get into it. Before we get to the signs, I need to address the single most important thing about thyroid testing after 50 because it explains why so many people have real symptoms and are told nothing is wrong. Most doctors test one number, TSH. TSH stands for thyroid stimulating hormone. It is produced by the pituitary gland and tells the thyroid to produce more hormone. When the thyroid is underperforming, TSH rises, like a manager sending increasingly urgent messages to a team that isn't responding. The problem is the reference range. In conventional medicine, hypothyroidism is typically diagnosed when TSH rises above 10 milli-international units per liter. But many clinicians who specialize in thyroid health define the optimal TSH range as 0.5 to 2.5, meaning someone with a TSH of 4, 5, or 6 may be told they are completely normal while experiencing every classic symptom of an underactive thyroid. This gap between what the lab considers acceptable and what the thyroid research considers optimal is where millions of adults over 50 are living. Symptomatic, dismissed, and told to accept how they feel as a normal part of aging. There is also a second problem. TSH alone does not tell the full story. The thyroid produces 2 primary hormones, T4 and T3. T4 is a storage form, T3 is the active form that actually enters cells and drives metabolic function. Many adults, particularly over 50, have adequate T4 but poor conversion to T3. TSH looks normal. T4 looks normal, but T3 is low and the cells are not receiving adequate thyroid signal. This pattern, normal TSH, normal T4, low free T3, is almost never caught on standard blood panels. It requires specific testing that most general practitioners do not routinely order, which is exactly why knowing these signs matters so much. Here is what to look for. Sign number 1. Persistent fatigue that sleep cannot fix, not the tiredness that comes from a demanding week. Fatigue is the most prominent symptom reported by approximately 83% of hypothyroid patients as their primary complaint. The specific pattern here is important. This is an exhaustion that is present in the morning before the day has even begun. It does not respond to coffee, rest, or a good night's sleep. It is a heaviness that settles into the body and does not lift. The mechanism is direct. Thyroid hormones are the primary regulators of cellular energy metabolism. Every cell in the body uses thyroid hormone to determine how quickly to burn fuel and produce ATP, the body's energy currency. When thyroid output drops, cellular metabolism slows across every tissue simultaneously. The result is not tiredness from exertion. It is a systemic energy deficit that has nothing to do with how much you have or haven't done. In adults over 50, this fatigue pattern is almost universally attributed to poor sleep, stress, anemia, or simply aging. Thyroid function is rarely the first thing investigated, and yet for a significant percentage of adults presenting with this specific fatigue pattern, unexplained, persistent, unresponsive to rest, low thyroid output is the underlying mechanism. The next sign affects something most people notice every morning. Sign number 2, unexplained weight gain, especially when diet and activity haven't changed. The thyroid is the master regulator of metabolic rate. When thyroid hormone output drops, the rate at which the body burns calories at rest, called the basal metabolic rate, drops with it. The result is weight gain that has nothing to do with eating more or moving less. The diet is the same, the activity level is the same, but the body is now burning fewer calories to perform the same biological functions, and the excess is stored primarily as fat around the abdomen and hips. This weight is notoriously resistant to conventional diet and exercise interventions because the hormonal signal governing metabolic speed has not changed. You can eat less and move more, and the scale will barely respond because the underlying metabolic rate has been reset at a lower level. In adults over 50, this pattern is almost entirely blamed on the natural metabolic slowdown of aging. And while aging does affect metabolism, thyroid-driven metabolic suppression is a distinct additional mechanism that compounds the age-related change and produces significantly more dramatic weight accumulation than aging alone would explain. If your weight has been climbing despite genuine dietary discipline, and particularly if it accelerated in a way that doesn't match your actual caloric behavior, thyroid function deserves investigation as a contributing factor. Sign number 3, cold intolerance, feeling cold when others are comfortable. Cold intolerance is one of the classic symptoms of hypothyroidism and one of the most consistently dismissed. Body temperature regulation is directly governed by thyroid hormone. Thyroid output controls how much heat the body generates through cellular metabolism. When output drops, heat generation drops, and the body loses its ability to maintain a comfortable internal temperature in environments that others find perfectly warm. The specific sign here is not general sensitivity to cold, it is a disproportionate cold, being the coldest person in the room, needing layers when nobody else does, feet and hands that are persistently cold regardless of ambient temperature, and a deep internal chill that is difficult to warm from the outside. In older adults, this sign is almost universally attributed to poor circulation, aging, or simply personal preference. But when cold intolerance appears alongside fatigue and weight changes, the combination is one of the most specific clinical patterns for hypothyroidism available. Sign number 4: hair thinning and loss, especially from the outer third of the eyebrows. Hair follicles are among the most metabolically active cells in the body and among the most sensitive to thyroid hormone levels. When thyroid output drops, the hair growth cycle is disrupted. Follicles spend less time in the growth phase and more time in the resting phase. The result is diffuse thinning, not the patchy loss of alopecia, but a generalized reduction in hair density across the scalp. But the most specific early sign, the one that most people never connect to the thyroid, is thinning or loss of the outer third of the eyebrows. This pattern, called metarosis, has a well-established association with hypothyroidism and reflects the particular sensitivity of eyebrow follicles to thyroid hormone withdrawal. If you have noticed your eyebrows becoming sparse at the outer edges, particularly if this change has been gradual and is accompanied by any of the other signs on this list, this is one of the most specific physical markers of thyroid underperformance available without a blood test. Sign number 5: depression, low mood, and emotional flatness without a clear psychological reason. This is the sign that surprises people most, because the connection between thyroid function and mood is rarely discussed outside of endocrinology, and yet it is one of the most direct and clinically significant relationships in all of hormonal medicine. Thyroid hormones directly regulate serotonin synthesis and receptor sensitivity in the brain. They influence the production of dopamine. They govern the speed of neurological signaling throughout the central nervous system. Depression directly results from low thyroid hormone levels, slowing down the central nervous system and directly affecting the brain's supply of mood-regulating neurotransmitters like serotonin. When thyroid output is low, the brain's neurochemical environment shifts toward the pattern associated with depression: low motivation, emotional flatness, reduced capacity for pleasure, difficulty engaging with things that used to feel meaningful. What makes this sign particularly significant and particularly dangerous is that it is almost always treated as primary depression, with antidepressants prescribed without thyroid evaluation. In adults over 50 presenting with new or worsening depression, thyroid function is one of the first biological mechanisms that should be ruled out, because treating depression without addressing a hypothyroid driver produces incomplete results at best, and in some cases no improvement at all. If your mood has shifted in the last 1 to 3 years in ways that feel more physical than emotional, a flatness rather than sadness, a low energy rather than acute despair, this is one of the most clinically important signs on this list. 2 more signs to go, and both are ones most people have completely stopped questioning. Sign number 6: brain fog, poor memory, and slowed thinking. Brain fog, forgetfulness, and difficulty concentrating are established hypothyroidism symptoms, and among the most frequently attributed to age in adults over 50. Thyroid hormones are required for the maintenance of neuronal connections, the speed of synaptic transmission, and the production of the myelin sheath that insulates nerve fibers and allows rapid signal conduction. When thyroid output drops, all of these processes slow. The practical result is that specific cognitive pattern, thinking that feels slower than it used to, words that take longer to come, difficulty holding complex information in mind, a mental fogginess that is worst in the morning and does not respond to caffeine or stimulation. The critical distinction between thyroid-driven cognitive decline and age-related cognitive change is that thyroid cognitive symptoms are largely reversible with appropriate treatment, unlike neurological aging, which proceeds regardless. Hypothyroid cognitive impairment responds to thyroid hormone restoration. This is why thyroid evaluation should be part of every workup for cognitive changes after 50, before attributing the symptoms to aging or investigating more serious neurological conditions. Sign number 7. Constipation and sluggish digestion that doesn't respond to dietary changes. The decrease in thyroid hormones slows the movement of the muscles in the digestive tract, and that can cause persistent constipation that doesn't respond to the usual interventions. The smooth muscle of the gastrointestinal tract requires adequate thyroid hormone to maintain normal motility, the rhythmic contractions that move food through the digestive system. When thyroid output drops, this motility slows across the entire digestive tract. The result is constipation that is not explained by fiber intake, hydration, or physical activity, because the underlying driver is not dietary but hormonal. Most adults who experience this sign spend years experimenting with dietary changes, fiber supplements, and probiotics, all of which address the symptom rather than the cause. The thyroid connection is almost never investigated for digestive complaints in the absence of other obvious thyroid symptoms. If you have experienced a persistent change in digestive function, particularly a slowing and heaviness that appeared gradually and does not respond to the usual interventions, this deserves to be mentioned to your doctor specifically in the context of thyroid evaluation. Sign number 8. High cholesterol, even without dietary explanation. Unexplained high cholesterol is sometimes the only evidence of an underactive thyroid in an older person, and because this sign may stand alone, high cholesterol warrants a thyroid evaluation. Thyroid hormones govern the rate at which the liver processes and clears LDL cholesterol from the bloodstream. When thyroid output drops, LDL clearance slows, and cholesterol accumulates in the blood regardless of dietary fat intake. This is why some adults maintain a genuinely healthy diet, have low dietary cholesterol, and still present with persistently elevated LDL levels that don't respond adequately to statin therapy or dietary modification. The connection between hypothyroidism and high cholesterol is so well established that many endocrinologists will order thyroid function tests in any patient presenting with new or worsening hypercholesterolemia, particularly in women over 50, where both conditions are most prevalent. If you are on a statin and your cholesterol is still not well controlled, or if your cholesterol rose without a clear dietary explanation, thyroid function is one of the most important things to rule out before escalating pharmacological treatment. If you recognized 3 or more of these signs today, what comes next is the most important part of this video. Now for the section that most videos about thyroid leave out: exactly what to do, what to ask, and what the evidence supports for thyroid health after 50. First, request the right tests, not just TSH. When you speak to your doctor about thyroid concerns, ask specifically for a full thyroid panel, not just TSH. The complete panel should include TSH, free T4, free T3, and thyroid peroxidase antibodies, also called TPO antibodies. Free T3 is the active hormone form that reflects what your cells are actually receiving. TPO antibodies indicate whether an autoimmune process, called Hashimoto's thyroiditis, is quietly attacking the thyroid. Both of these markers can be abnormal when TSH appears normal. Know your numbers. Optimal TSH for adults over 50 who are symptomatic is generally considered to be between 1.0 and 2.5, not simply below 4.5 or below 10. Second, selenium, the most evidence-supported nutrient for thyroid function. Selenium is required for the enzymatic conversion of T4 into the active T3 form. It is also one of the primary antioxidant protectors of thyroid tissue, and the thyroid contains the highest concentration of selenium of any organ in the body. Research consistently shows that selenium deficiency impairs thyroid hormone conversion and is associated with elevated TPO antibodies in Hashimoto's thyroiditis. The best food sources are Brazil nuts, 1 to 2 per day provides the full daily requirement, and sardines, eggs, and sunflower seeds. If supplementing 100 to 200 micrograms of selenomethionine daily is the dose most consistently used in clinical trials. Third, iodine, the essential mineral most people get wrong. Iodine is the structural building block of every thyroid hormone molecule. Without iodine, the thyroid literally cannot produce T3 or T4. While severe iodine deficiency is uncommon in the United States due to iodized salt, many adults who have reduced their salt intake or eliminated processed foods may be consuming less iodine than they realize. Seaweed, fish, dairy, and eggs are the richest dietary sources. The key nuance: more is not better. Excessive iodine supplementation can paradoxically suppress thyroid function, particularly in people with autoimmune thyroid conditions. Food-based iodine through a varied diet is the safest approach. Avoid high-dose iodine supplements without medical supervision and confirmed deficiency. Fourth, address the thyroid disruptors that accelerate decline after 50. Several common factors directly suppress thyroid function and are highly prevalent in adults over 50. Chronic stress and elevated cortisol directly inhibit the conversion of T4 to active T3. Chronic sleep deprivation impairs TSH secretion patterns. Insulin resistance reduces thyroid receptor sensitivity. Environmental toxins, including fluoride and certain plastics, contain compounds that compete with iodine at thyroid receptors. Addressing these upstream drivers through cortisol management, sleep optimization, blood sugar control, and reduced toxin exposure is as important as any specific nutrient intervention for long-term thyroid health. Important note: if you are experiencing significant symptoms from this list, particularly fatigue, weight gain, depression, or cognitive changes, please do not attempt to self-manage thyroid function based on this video alone. Request a medical evaluation with a full thyroid panel. If your doctor is unwilling to test beyond TSH and you remain symptomatic, a second opinion from a functional medicine physician or endocrinologist who specializes in thyroid health is entirely appropriate. You deserve a complete answer, not a dismissal. Today you saw the 8 silent signs of an underactive thyroid after 50, the ones that have been blamed on aging for years while the real driver went undetected. From the relentless fatigue and unexplained weight gain, to the outer eyebrow thinning in sign number 4, to the depression in sign number 5 that most doctors treat with antidepressants without ever checking the thyroid, to the high cholesterol in sign number 8 that is sometimes the only visible sign of a thyroid that has been quietly slowing down for years. And you saw the 4 practical steps that the evidence supports: the right tests to request, selenium and iodine for thyroid hormone production and conversion, and the upstream factors that are silently suppressing thyroid function in millions of adults over 50. Here is what I want to leave you with. The thyroid is not a minor gland. It is the metabolic conductor of the human body, and after 50, it is one of the most commonly compromised and most consistently overlooked systems in medicine. The fact that a test came back normal does not always mean everything is fine, and the fact that you've been told to accept these symptoms as aging does not mean you have to stop asking questions. Ask better questions, demand better testing, and know what you're looking for. If this video gave you answers you've been looking for, please hit the like button. It helps this channel grow and reach more people who need this information. Subscribe and turn on the bell so you don't miss the next videos. Share this with someone over 50 who has been told their thyroid is fine but still doesn't feel like themselves. This video might be the reason they finally get the right test. And leave a comment right now. Tell me, which of these 8 signs have you been experiencing? And have you ever been told your thyroid is normal despite having multiple symptoms? I read every comment personally, and your question could become our next video. I'm Dr. Carter, I'm here, and I'll see you in the next video.